Northern Health covers nearly 2/3 of British Columbia, delivering care through innovative and flexible programs. But how do you support a workforce that stretches from busy hospitals in Prince George to remote nursing stations at the very top of the province? The key lies in clear, reliable data, powered by the small but mighty HR planning and analytics team.
The challenges that Northern Health faces when they don't have access to reliable data is that the operational leadership are unable to recognize trends in their workforce or spot issues. They're unable to find data to support evidence-based decision-making, and what used to take hours to answer can now be answered in minutes.
The team introduced technology, systems, and processes that turned raw data into powerful tools for decision-making. Their approach to data visualization was particularly noteworthy by transforming complex data sets into easily understandable and impactful visual presentations like vacancy heat maps and staffing timelines. Our workforce is our greatest asset, and these tools allow Northern Health leadership to recognize trends and more efficiently address challenges.
A tool I'm particularly proud of, I would say, is our vacancy reporting. This tool allows us to see the vacancy shortages in the form of a heat map. It allows us to do vacancy trending, see our supply-demand growth numbers, as well as span and control information for managers. We are in a global nursing workforce shortage, and this tool allows us to address our critical vacancies. By knowing this information and strategically planning to address these issues, we have been able to reduce our vacancy rate for the first time in years.
One of the challenges that we have in the healthcare system is that we've got lots of data, but a lot of it is stored in many different systems and locations. And when you're trying to make decisions, whether around what to do operationally or to look ahead into the future, what you really need is data to come from a bunch of different spots, get combined together, and maybe do some math on it to give you the information you need to make a good decision.
The impact has been clear. Leaders now have the tools to anticipate challenges and recognize positive trends. Staff feel supported, and patients benefit from a more responsive healthcare system.
So generally speaking, when you've got these dashboards that pull in the net result of thousands of interactions and encounters that are occurring every day, the team can see how their daily actions are making a difference at a community level. And having the information like that allows them to draw a straight line between why they got involved in healthcare, what they do on a daily basis, and then the difference they're making for the community. And it's more than just a line or a graph or an image, it's people. And when you have it visualized that way, you can make that connection.
At its core, planning and analytics is about ensuring the right care at the right time, in the right place. And that means better healthcare for everyone in Northern BC. Congratulations to the HR Planning and Analytics team for leading your field in data-driven decision-making, not just for staff in Northern Health, but for every patient, no matter where they live.